Guys, we always get asked this question, what causes low back pain? So today we're going to talk about that. When we're looking at low back pain, there's three specific things we see in our office. One is what we call repetitive stress, two, inactivity, and three is what we call the corporate lifestyle. And that's what we're going to focus on today. Now, we talked about before that you should have a nice 40-degree curve in your low back, okay? And the reason we want this, it's going to evenly distribute the weight of our body, okay, on those joints. Now, as you can see here, okay, we're going to go through a couple of things. When we take a look at a joint, okay, what we want to see is that we have an upper bone, a lower bone, and a disc in between. And if you guys can notice, okay, I want you to look at how much of a diameter, how thick that is, okay? That's what a healthy joint is supposed to look like. And what this joint does, okay, especially that disc, is what we call a shock absorber. So all that weight that's pushed down at you, which we call an axial load, is being pushed straight down on top of those joints. And we have to have something there to support that, right? So these discs are what hold that weight together. Now we're going to talk about proper biomechanics of what a joint should move. So let's go through it together. So when we look at a joint, what we want to see is that it should be able to move forwards, backwards, side to side, and rotate without any restriction. Now, when we're sitting at work and we're hunched over like this all day, over time, these joints go from their normal 40-degree alignment and they start to shift out of alignment. And when they shift, what happens is they get stuck. It's either called a fixation, joint restriction, or a medical term for it is called a subluxation, okay? This term is used and it's what we do in our office, is what we treat. So when we see these and when we find these on our specific state-of-the-art digital x-rays, we allow us to see specifically why that joint isn't moving properly and why, okay, the health of that disc isn't good. Now, let's talk about a poor disc. So when we get stuck up in life and we're stuck at work all day, we're in that corporate lifestyle, over time, years, repetitive stress, days on end, weeks and months, okay, cause these joints to start to look like this. Now, we can see how we start to have roughened joint edges, and remember, we wanted to have that disc nice and thick, right? You can see how thin that disc is as well. You can see this red tissue that's poking out. This is what we call a disc herniation. It's not good. What that's going to do is put pressure on these delicate nerves in your low back. It's going to cause you to have that low back pain, that sciatica, that numbness, that burning feeling that you're currently feeling today is what's going to be caused by this. Now, in our office, we do a state-of-the-art technique known as Flexion Distraction, where it allows us, okay, to open up that joint space, realign that disc, and allow the nucleus of that disc to recenter. By doing this, we're able to re-engage the health of the disc and bring it from poor, okay, all the way back to healthy. We're going to go through that specifically here, but I guys want you to know that disc health is extremely critical. All this axial load of gravity pushing down on you is going to cause you over time, okay, to have what we call a disc herniation. And remember, disc herniation is not good. We don't want that. If we find that, okay, and if we see that this is what the cause is, we're going to do that state-of-the-art technique, which we just talked about, Flexion Distraction, which we're about to demonstrate right now. If you're having low back pain and your discs and joints look like this, okay, you're not in good shape. So let's talk about a few things. Remember what we said before, we want that disc height to be nice and thick. As you can see here, right, we're super thin. It's almost bone on top of bone, okay? That's not good. What that does, it rubs the bone on top of each other like this, and over time you're going to have degeneration and degeneration keep forming on top of that. Now again, when we lose the disc height, okay, that has to go somewhere, right? So as you can see here, we have this red tissue compared to this clear tissue here. You can see how it's directly impinging, okay, that IVF, which is called the intervertebral foramen, where that nerve comes out of. It's very important that this hole is open to allow you to have proper nerve function and that the joint's able to move forwards and backwards and side to side without any type of restriction, all right? Now, through specific chiropractic digital x-rays as well as specific technique known as Flexion Distraction, we're not only able to diagnose but able to treat this state-of-the-art tissue without any type of interference to that joint. So it's non-surgical, non-drug approach, and by doing this, we're allowing the joint to properly heal. And what we're going to do is we're going to contact the upper joint here, and we're going to contact the lower joint, and what we're going to do is we're going to open that space just like this. And by opening that space up and down, okay, we allow the natural vacuum of the body to suck back that fluid and bring the nucleus back to the center. And over time, as you do this every other day or every couple of days, what happens is that joint's going to keep pumping and pumping and pumping, and eventually you're going to be able to restore that function of that disc. which is the goal that we want to achieve, right? Because we said disc herniations are gonna cause you to have that low back pain. So what we're gonna do today is demonstrate that on Amber. So I'm gonna get her set up. So we're gonna make sure Amber is securely locked out with her legs here. What we're gonna do is make sure that we're gonna treat that low back here, L1 through L5. So depending on what joint, okay, and what level that disc is at, is where we're gonna contact. So what you're gonna see me do here is contact with my left hand, what we call the spinous process. Those are the bones on the back, those really pointy things that you can feel. And I'm gonna open that up and bring it back, and we're gonna do that a couple times to the joint level. So as you see here, what I'm going to do is take my thumb, I'm going to contact what we call L1. I'm going to hold L1, I'm going to pump Amber's legs down. And by opening up that disc, I'm going to allow for that vacuum, and allow that fluid to continually pump back into the disc and allow that nerve hole, which we call the IVF, to open up. Over time, if we do this enough, what happens is that the joint is going to be able to be restored, allow proper functioning of that disc, and allow that joint to be opened so that we have proper nerve flow and no pain. So we're going to do this a couple times. We're going to open up those joints. We're going to make sure that we have enough pressure to hold on to those joints. And this is going to give you a lot of instant relief, because restoring that function to that joint is going to allow you to have a better shock absorber, right? So we want to make sure that we have enough space in between those joints to allow for the joints to properly move.